Chris Lama, and the topic today is inguinal ligament. The inguinal ligament is a band running from the pubic tubercle to the anterior superiliac spine.
Before we look at the muscles, there's one important structure that we need to add to the picture, the inguinal ligament. Here's the inguinal ligament. It's a strong band of tendinous tissue that goes from the anterior superior iliac spine to the pubic tubercle. There's a gap between the inguinal ligament and the underlying bone. Through this gap, some important structures pass from the abdomen to the thigh, including the femoral vein, artery, and nerve medially, and the belly of the psoas and iliacus muscles laterally. The inguinal ligament isn't an isolated structure. As we'll see, it's the lowest part of the external oblique aponeurosis, which is the outermost of the muscular and tendinous layers of the anterior abdominal wall.
The groin area is very sensitive, and any damage to it can cause pain and discomfort. The inguinal ligament is the primary ligament responsible for supporting the area around the groin and help keeping it safe. Its main function is to prevent the occurrence of an inguinal hernia or protrusion of certain portions of the intestine into the groin. An inguinal hernia occurs when a portion of intestine spilling out of its normal place and fall into the groin area. While surgery is often recommended for the correction of the hernia, certain exercises are part of treatment. These exercises help in strengthening ligaments for a relaxed and can be prevent a hernia. Some pros and cons. Some pros are walking, swimming, indoor cycling, stretching, hamstrings, hip rows, and balanced diet. And some cons are, for example, muscular exertion, overweight, malnutrition, smoking, constipation, chronic cough, old age. An important surgery exists in Ecuador, the laparoscopic repair of inguinal hernia. An inguinal hernia repair is an operation to push the bulge back into place and to strengthen the abdominal wall. The operation may be recommended if symptoms are severe, last for a long time, or if there are complications.
Repair requires a relatively large single incision. Newer laparoscopic techniques require only tiny keyhole incisions or puncture wounds, which generally result in a shorter recovery period. When access to the hernia, your surgeon will use sharp instruments called trocars to create 3 small holes or ports through your abdominal wall. The location of these ports will vary depending on your surgeon's preference and the type of procedure. One of these ports is usually located at your navel or umbilicus. Carbon dioxide gas will then be pumped through the umbilical port to puff up your abdomen so its contents can be viewed more easily. Next, your surgeon will insert the laparoscope through the umbilical port. Images from its camera are projected onto a video monitor in the operating room. Your surgeon will then pass various instruments through the other ports. These will be used to dissect away the hernia sac and to tack a piece of mesh over the hernia opening. This will prevent the intestine from slipping back through the opening. Before removing the laparoscope, your surgeon will take one final look around for areas of bleeding or other damage. A port valve is briefly left in place to allow all the carbon dioxide to escape from the abdomen. Finally, the keyhole incisions are closed with sutures or staples and
the section of intestine can become of the stuck in the inguinal canal, causing an obstruction. It causes nausea, vomiting, and stomach pain, as well as a painful lump in the groin, or trapped and have its blood supply cut off. Now, as